Oh. I just realized this whole time I haven't added my face to the stream. It's powerful. I'll just start it again, maybe. I'll just end it and start it again. I feel like an idiot. I'm sorry if anyone was trying to jump on and they were like, what's happening? Are you talk? I don't even know if you could hear my voice. I was talking all this time. And it was like nothing. So, yeah. That's terrible. I'm using a different program to run it, and I didn't add myself to the stream, and then I just realized it was a blank screen this whole time I've been talking. So welcome, people, because I was like, why isn't anyone on the stream? That's really unusual. Normally there's a few people on there by now, but it was just nothing. So sorry about that. That's my bad, my terrible technology. So yeah, if you have a question about Chinese medicine, I don't know if anyone's heard the start of what I was saying, so I'll go back again. If you have a question about Chinese medicine, you want to talk about it, this is the place to do that. Hello, hi Hare Krishna, hi Ava Sharma. If you have a question about acupuncture or herbs or how it works or something like that, then please feel free to ask it. I was mentioning this book because someone asked me a question about Western herbs and Chinese herbs. As in, do you know any books about Western herbs, how they work in Chinese medicine? And this is one of the books that I've used for when I have a herbal tea business. And when I was designing those herbs, the teas, and thinking about, okay, I want to use things like, for instance, the echinaceas in this book. What does it do in Chinese medicine? And what are its functions? Now, it's really much more of a scientific theoretical text than a manual of how to, here's 10 herbal teas you can drink for, losing weight or something like that. It's not one of those kind of books. So there's a lot of, I'll just bring that a little bit closer so you can kind of see. That's kind of what it looks like in terms of the detail, the level of detail in this book. And you can see that it's a huge book. It's giant, it's heavy. So I would recommend this if you are wanting more, as I don't think there is anything else that's as detailed on those herbs available. And this is by Jeremy Ross and the foreword by Julian Scott. So I think there's 2 volumes. And you can see how big this is already. It's huge. So it doesn't have all of the Western herbs in it for sure. But the ones that it does have, it's very detailed. Takes a little bit of time to go through. If you're not a Western herbalist and you don't know the names, you kind of have to go through looking up their names in a Latin sense. Just trying to have a look in the list here. So it does have some herbs that are Chinese herbs already, like ginger, salvia, which is sage, licorice is in there, and that's a Chinese herb. Echinacea. What else? There's heaps and heaps of herbs here, but I don't know all their names. Capsicum, cinnamonium, which will be cinnamon. And that might be interesting because I don't know how, there's so many different breeds of cinnamon or styles of cinnamon, whether there's a difference there between Western cinnamon and Chinese cinnamon that this guy kind of can really know. Like, how do you know that? Yeah. All right. So that's enough of that book. Okay, Hare Krishna's got a question. Good, I love the questions. How to diagnose patients? Ava Sharma. That's a big question. That's what you go to school for. That's what you go to Chinese medicine school for. I can talk about how a Chinese medicine practitioner diagnoses and what we do for sure. We can definitely talk about that. That's a big question though. So if you've got something specific you wanted to know about, you might want to put that in there. Because this stream could take all night with that. Okay, Hare Krishna says, I have a few basic questions on acupuncture. How do traditional Chinese doctors treat diseases? Do they combine all the Chinese methods to treat a particular disease? That's a good question. So when you study acupuncture, there's one system of medicine, which is the system of Chinese medicine. So the understanding of how your body works and the understanding of how you get sick. And so basically how disease arises. And that is a different system to a Western medicine system, right? But then there's all these different treatments. So you might have gone to an acupuncturist, and they might have had like acupuncture, cupping, gua sha, which is like this scraping thing, moxibustion, and there's all these different things. And then within acupuncture, there's different sizes of needles, there's different shapes of needles. There's like bleeding techniques where the points would be inserted and then blood would be squeezed out of the points. There's techniques where you leave the needles in for a long time versus putting the needles in, stimulate them and take them out. So how does an acupuncturist know which is the most effective technique to use? What's the most appropriate for that patient? And this can also change as the condition or what's wrong with them kind of changes. So initially when you go to a practitioner, they may do a certain thing and then you think, oh, two weeks later I'm getting something else done on me. They're doing something else. That can be quite common because things have changed, or maybe because they've done something and then your condition hasn't changed enough and they thought, well, we'll use something else now because we've given this other thing a try enough. We've given it enough doses, let's say, of the treatment. Or they might have, there's different options for practitioners. They can have like lots of things, tools up their sleeve, let's say, lots of options to use, which is great. Now, when this combination of these different methods of treatment depends on, one is the style of study that you go to. So some schools of Chinese medicine focus on teaching practitioners how to do things a certain way. And then you have other schools of thought which are like combining them together. And sometimes within a school, like typically, like for instance, the school I teach would be very typical of, so that's very typical of how I was trained. And I think how lots of people in university systems are kind of trained, is that you are exposed to all these different things. Like as in the students learn about a lot of things, but whether how much they know about those things is kind of, how much they utilize those things might be up to what kind of like practitioners they have in the student clinic, what kinds of supervisors they have. And so that might then influence the style of treatments that they get exposed to doing. Like there's some styles of acupuncture, which is like called Japanese acupuncture and Chinese acupuncture. And those two systems are really, really different how they're practiced. So Japanese acupuncture, if you've ever had it, it's very subtle. You don't put the needles in I hope the stream isn't just got a flash then, so I hope it's not breaking down. The Japanese acupuncture is very subtle, which means you don't feel this chi feeling. You don't feel this achy, heavy tingliness as much as often as you would with the Chinese style acupuncture. So yes, some practitioners combine lots of things together. Like it would be common for me to give my patients acupuncture and cupping together, or acupuncture and moxa together. Sometimes you do all three. Maybe it depends on really what's wrong with them, and it depends on how long you've known that patient for. Sometimes, like if you do 2 or 3 things at once, you won't know what's working and what's making it worse. And sometimes some treatments could aggravate things, especially if it's the first time you've seen someone. Like sometimes you can overstimulate people with doing too many things at once. Like if they've got really, let's say, back pain, and you do acupuncture needles in there, and then you also put cupping and moxa, sometimes it's too much for people. Whereas if you just do one thing or 2 things at a time, that might be better. Now, there's been tons of times where I've done all those things together. So it really depends on the practitioners, comes down to their discretion. And that's kind of what they're trained to do at school. So that would be, hopefully that answers that question. We can answer the start of that one a little bit when we talk about how to diagnose patients question. What's the difference between acupuncture and acupressure? So pretty much it's just like, here's an acupuncture needle. So acupuncture like punctures the skin with this needle. So there you go. See if the camera can pick that up. If I get my face out of it, it might do that. There we go. So that's an acupuncture needle. And this is going to go in the skin and stimulate the point. Whereas with acupressure, you're just pressing a point. So they're the same points that are used, but you'll sort of make sense when you think acupuncture. I can be one acupuncturist and I can stick lots of needles in lots of different points at once for a patient, but with acupressure, I've only got 2 hands, so I can only press the maximum of 2 points a night. It's very hard for me to press something on the head and press something on the patient's foot, even for patients themselves. So acupressure, technically patients could do that themselves, but they also need to know how to do it properly, because it's not just a matter of touching the point, like, oh, tapping the point here and, you know, oh, I've like, here's some acupressure points, acupuncture points. But I'm not really doing much to those points, especially if those points were on my hand. Let's say you're not just tapping the points, you actually have to get right in at the right angle, press the point properly. I've got a couple of tutorials on my channel here about how to do acupressure for certain points. So one would be knowing, well, what points should I use? Not just sort of randomly tapping all over the body, hopefully. And then secondly, how do you press those points? So how hard do I press them? Do I have to for it to be effective? Sometimes with acupuncture, it's more effective just because simply you can do lots of points at once, and you're getting this unlocking effect of fascia and muscles and things like that. It's not just for musculoskeletal stuff. It's acupuncture is treating internal medicine kind of situations as well. But that's like ability to do 1 or 2 points at the same time is a big difference with acupuncture and acupressure. And then you've also got the thing of like, well, like this is a needle going in you. It's a piece of metal going into your body. Whereas when you're pressing, there's nothing going into your body. So some people within Chinese medicine and acupuncture over the years, like, because people think, well, how does it work? Like even acupuncturists are sitting there thinking, how does it work? How does all this work? Like there's all this knowledge about you do blah, 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 and then this should happen, right? And so lots of acupuncturists are doing that in their clinic, but there's just so many theories that are purported about how does it work. We're at the stage now in like knowledge of stuff that we know more than we've ever known before about how it works, but still no one can say, well, this one way is exactly how it works. So there's a lot of ideas about, well, what happens when metal goes in your skin. Now, it's not enough metal to cause you to feel the detriment of like getting a splinter. Like if you've ever had a splinter, it's very uncomfortable, and you have this idea of like something's foreign is in my body, and that's making you really uncomfortable and causing you pain. So you still have this foreign body response to metal being in your skin, but it's just enough time sort of for you to have this response, and then that's taken out. And the fact that this is sterile means you're not getting an infection from it going into your skin either. And as the needle goes in your skin, you probably can't see so much here, but I'll get my face out of this because then the camera will focus on it. So this is the shaft of the needle, right? And the shaft is very, 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 so the bit you can see the most is the handle, and then this is the shaft. So the shaft is that flexible part like that. And that flexible part tends to, like if it's going in, I'll see if I use a pen so you can kind of see more. So let's say my skin is my hand, and this is the needle, and it kind of goes in. Now, because it's flexible, as it goes in, if it comes across a blood vessel or a nerve, it tends to push it to the side. Also, because the shape is like that rather than a piercing shape, it tends to push it to the side rather than pierce right through it. So that tends to stop this superficial kind of injury happening. And what I was getting at before, when someone asked, well, what kinds of styles of Chinese medicine? I said there's bleeding methods and stuff like that. There are different shapes of needles, and some needles are designed to cut through because the purpose of the needle is to cause a bleeding in that superficial area. So yeah, that's a good question. These are great questions, guys. So feel free to ask your questions, and I will try to answer them for you. So he asks that, or she asks that, difference between acupuncture and acupressure, which is best. It depends on the circumstance. So as a practitioner, definitely acupuncture is better than acupressure because you can do more things with it. But at home, if you can't see an acupuncturist, there's lots of things where acupressure can help. But for instance, for myself, like if I'm unwell, like if I had pain and I have the knowledge of both of those things, and sometimes like you're even too lazy to get the acupuncture out yourself. You just think, oh, I'll just press this point. So you can get some relief with acupressure, but I always find the acupuncture is more effective than acupressure by itself. But if you have nothing else, like I've been in a situation where you haven't had any acupuncture needles, you've been on an aeroplane, for instance, and the pain's really intense or something, it's better than nothing at all. Yeah. All right. How many years do you have to study to do acupuncture? 4 years in Australia. That's the minimum course. You can't do a course for less than 4 years and be accredited by APRA, which is the registering body of Chinese medicine. And 4 years is a pretty standard amount of time to study. I did a course which was like a 3-year course, which then expanded out into 3.5 years. But that was at the time where we didn't have registration and we didn't have, there was no governance on saying, well, this is a certain amount of time. And so there's a lot of practitioners who are older ones who've done a 3-year course. I did 3 years with acupuncture and herbs, and it was intense. There was a lot of units and there was a lot of stuff going on in that. But those days are gone now. You can't do those 3-year courses for herbs and acupuncture anymore. Okay, if the needle punctures a particular organ, no, it's not okay. That's not what we want to happen. And that's why you need to go to acupuncture school. It's very dangerous to kind of do acupuncture without any training. And there have been cases where people have done a thing called dry needling and caused injuries because they just haven't had the knowledge of not so much the needle, where the needles are going, but partly of that is the angle of insertion. Like, I'll give you a good example. Here's a point here on your shoulder, right here, gallbladder 21. So at this point, you can needle perpendicularly. I'll take this off a little bit. So perpendicularly would be straight up and down. This is the needle, right? If I needle straight up and down, I've probably got about 1 centimetre, 2 centimetres, of, let's say, leeway, depending on how thin or large or thick the patient is, let's say, fat the patient is. If I needle it this way, which is possible as well, and that's how I normally do it in my clinic, then you're definitely needling through that bulge of the trapezius muscle. And by needling it this way, there's no way that needle can go anywhere any deeper accidentally or anything like that. So there's a lot of this kind of one part of acupuncture study is you learn where are the points. So simply like acupressure. And your other question about what's the best one, acupuncture or acupressure? Well, there's less danger with acupressure. You can't puncture your lungs with acupressure. Like, even if I press this point really hard, I'm not going to be able to puncture my lungs. Whereas acupuncture, there is a risk there. Right? So any medicine that you take or have done on you, there's always a risk. And so it's about balancing that risk and reward, right? If we do nothing at all, what will happen? How much of a risk? Like if you do surgery, there's a risk. If you take medication, there's risks, all those kinds of things. So, oh yeah, I just realized I can do this. So that was if the needles can puncture a particular organ. Is it 3 sun or 4 sun needles? Oh, so right. So obviously you know you know about Chinese medicine if you're saying that's 3 sun. There can be all kinds of measurements. So a sun measurement, or do you mean 3 centimeters? But I think you've written sun. So a sun is 1 finger, 1 thumb's width. This measurement is 1.5 sun, like 2 fingers together. 2 fingers like slightly spaced apart would be like your 2 sun. And then this 4 fingers together is 3 sun. So, like it depends on where the needles are going in and also the depth. So on the hips and the waist, like the lower back, let's say on the hip, on gallbladder 30 would be a point. The needles can sometimes be like, you can buy 100 millimeter needles. This one here is a 40 millimeter needle. So what that means is the shaft of the needle. So this is a kind of a longer one, and they can be 30 millimeters. So this 41 would be about 2.5 sun long, 40 millimeters. Again, sun is kind of well, sun is always relative to the patient, whereas these things are not relative to the patient. They're a standard measurement. Like, it doesn't matter how big the patient is. This is how big it is. So, yeah. Your next question. Suppose one has to learn acupuncture by yourself, where should you start? Because there's no courses near you, because there's no money. There's no money near you. You can't start studying, that kind of stuff. So yeah, and look, there's a lot of things you can start learning, and then once you go to school, you'll be ahead of everybody else in a way, because you'll kind of have that knowledge. The good thing about Chinese medicine itself is it never changes, right? Like, a new thing doesn't come along and go, oh, well, that wipes out all the old stuff. Like with Western medicine, there'll be one day they'll be like, oh, we're using, this dose of ibuprofen to manage pain for this, and that's what we're doing. And then next thing you know, another thing comes along and they're like, oh, we're not doing that anymore. So you're like, oh, that knowledge was redundant. So the things you learn in Chinese medicine, especially the basic knowledge, that never changes. It's from the Han Dynasty. It's never going to change. So knowing, if I was you and you were kind of interested in it, you could either start with reading some Neijing texts. So there's a couple of, like, there's the Neijing, Huangdi Neijing is a text that's, especially if you're a scholarly kind of person, but you might need someone to kind of guide you of how to read that, how to understand it, what does it mean, but just being exposed to it is a good place to start. And then just learning where are the points and so firstly, what are the channels? What are the 12 channels? I remember my old Chinese medicine teacher used to call them the 12 regular channels. And so what are the channels? So your pathways, right? And what are the points along those channels? So you always have to remember those, or you have to learn those. And then you have functions of those points and channels. I'm just going to quickly, see, I've just touched that microphone. I'm going to quickly grab a textbook and show you, okay? 2 seconds. Still here. Just grabbing a book. So I'll grab you 2 books. One book is this one here. This Foundations, Deadman's Acupuncture. So 2 books you can get. One is this one here, which you'll definitely need anyway if you're going to study it. So this is called the Manual of Acupuncture. And this basically just goes through every point in Chinese medicine. See if we can get that to... There you go. So that just opens straight up at stomach 38. So you'll see a little diagram and it'll talk about where is the point and what does it do. Where is the point and what does it do? And that's a good... What does that mean? 3 sun on my chest. I feel like I'm about to die. Extreme pain. I don't know what you mean by that. I hope you're okay. If you're in trouble, you should go to the hospital if you've got pain. I'm going to get to other people's questions in a second. We've got one about liver qi stagnation. We've got one about damp heat. So I'm definitely going to answer those questions. The other book I would get is this one called Foundations of Chinese Medicine. Now, this is a very old version of this book, Giovanni Maccioccia. But that's a good place to start, to just understand the very basics of what Chinese medicine is about. I'm not recommending that you could learn acupuncture by yourself. Even if you don't go to university, you have to have a teacher guiding you, depending on the laws and stuff in your country. What can happen is then you won't be able to practice. You won't have a job because you won't be able to get registered. So that's why you need to go to school and do all that. And what they'll teach you at acupuncture school is not just how to learn about acupuncture and Chinese medicine, but how to manage all the other things that you have to do as a practitioner, even if you're not running your own business, but like how to deal with difficult patients, how to deal with the stress of the job yourself, like how to read research papers, how to integrate, how to be in society with other practitioners and things like that. and like how to run your business in terms of how to run your practice. Like there's so much stuff that you learn. I've taught a lot of units at the college where I teach, like a lot. Like, so I've had an experience of all the different levels of things that students learn. And there's probably a lot on social science, and you also learn biomedicine, like Western medicine, the basics of that. Now, I did that at my school, but we didn't do as much social science and research paper reviewing and all that kind of stuff, being academic. Okay, so that's where I would start. And there's lots you can do when you first start. So someone asks, RJ Fenty, when someone has patterns of liver qi stagnation, spleen qi deficiency, and dampness, what would a typical recommended meal look like for them? Okay, that's a good question, because these are very common patterns and also really common to have together. And look, sometimes with Chinese medicine, one thing to think of is the more complicated the problem, the more simple the solution should be. So with diet, it always comes down to this. No matter what the problem's going on, it always comes down to give the spleen and stomach the simple things, right? Remove all the complexity. Now, by complexity, the richness, the density, the high concentration of flavors. So things like sugars, fats, like salts, these extra things that add the flavor. It doesn't mean that flavor is bad for you, but especially these combinations of these things, which is very often in these rich things. And this kind of idea of coming back to a clear, bland, or a Qing Dan diet, right? So for qi stagnation, you generally want to have smaller meals and like make sure the person, of course, with all these things, especially spleen qi deficiency and dampness, regularity is important. And so if you're keeping your meals regular, you're avoiding overeating. So when you have qi stagnation, particularly as well, sometimes it can be hard to get that peristalsis to get things moving, and you can feel really overwhelmed by eating too much, right? So what happens is if you get, because how you got qi stagnation is probably from lifestyle. And so you're probably not regular with things. And that's why I'm mentioning it, because if you had regularity of especially of exercise, a balance of that kind of stuff, you may not have that stagnation, or it wouldn't be manifesting as much at that time. Certainly exercise and movement is like the remedy to stagnation in a way. So if you get busy at work and you've got a lot of stuff coming in and you've got a desk job and you're sitting, I would always recommend with this kind of person to have soups available. Like make a big pot of soup once a week and freeze them in cup portions or small portions or things like that. Now, I do that for me because I get busy in my job. Like I'll either get busy with patients, seeing patients, or sometimes when I'm in my teaching job, like I'll teach for 3 hours, and that might be, oops, didn't turn my phone off. I might teach for a 3-hour period, and there's a break time in there, but often students are like coming up to asking me questions and things like that. So I don't eat as regularly, right? So as in you might forget to eat in that period, and then you finish that 3-hour thing or that 5-hour thing that you were doing, and then you're so hungry at the end, and then you tend to eat more, like overeat. So the one way to avoid that is to pre-prepare stuff that, is there available in advance. So soups are good, especially vegetable type of soups. So I would usually do a vegetable soup with a chicken or a beef stock. So I usually use a beef stock because I like to make my own stock. And that kind of then helps to just tonify, because you don't just want to clear. Like with this kind of person, eventually they're going to, if they're not deficient, they're going to get deficient. And by being spleen qi deficient and then generating dampness, you generally want to warm up the person. And for spleen qi deficiency, you typically want to have pungent food. So I know I haven't said, oh, this is one meal. So one meal that would be good would be curry. Okay, like a curry without too much carby stuff. So with either rice, like fresh basmati rice or something like that, like a chicken curry or a beef curry or something like that, without too much richness in the curry. Like, yeah, so spicy, pungent, warm foods are good as a hearty kind of meal. Soups are good. What else? Protein cooked, like chicken breast grilled, or a steak with salad, and like smaller portions, like not a huge massive steak. With if you have chips at a steak and it's such a big portion, then that tends to not be as good. So you want high quality meats or veggies. So then you need like steamed, or if you don't have soups with it, you could have steamed veggies with your steak or with your meat, something like that. Those kinds of things are good. Yep, in general. So for dampness, you want to stay away from the rich and dense stuff. Same with spleen qi deficiency. But both spleen qi deficiency and liver qi stagnation, you typically want pungent. So you want ginger. Could have cinnamon, but ginger is really good to have in the diet in that case. So I hope that's answered the question for you. Yeah. So you firstly start with that clear. That's a great question. We'll come to that one in a second. Yeah, I like these ones tonight. There's some different things going on here, so that's good. It's about 10:30 for me tonight in my time, so I'm just having a glass of wine now. It's possible. Is it possible to be both damp heat and cold damp in different parts of the body? For example, a person is cold damp, but then eating hot natured foods results in canker sores. Yeah. So, Alex, this is one of the reasons why I sort of found myself gravitating towards classical Chinese medicine, because in strictly TCM, there's some of these things aren't properly explained. So, yes, it's possible, but I don't know whether TCM kind of explains them well enough, right? So, firstly, if you have a true damp heat pattern, you're going to have a thick, greasy, yellow tongue coating. That's a proper damp heat pattern. And you'll have a type of pulse that kind of goes along with that as well. So you generally have a rapid, slippery pulse of some sort on one of the sides of the body, depending on where the damp and heat is. So technically, if that's kind of raging on, you don't have cold. You wouldn't have cold damp going on as well, right? But it's common to see symptoms of cold and symptoms of heat, but not you wouldn't. Then it probably isn't like what we'd say a true damp heat or damp cold pattern. Generally, what practitioners should do is when we check the pulse, that's kind of telling us what needs to be treated now. And then patients kind of have a story usually, and this happened and that happened and this and then this. And now I've got these, blah, blah, blah. This is my symptoms I've got now. So especially in a classical Chinese medicine approach, we typically go, okay, this is the thing that's happening now. This is what we're treating now, because this is the most prominent thing for you. And your pulse is saying we need to kind of treat that. But then once that is cleared, then the real deficiency might manifest itself. So it's possible for someone to be deficient, right, and have what you might say is cold damp, but then on top of that, get this damp heat going on. For them to have a true damp heat condition, they probably need to have a fair bit of yang in their body anyway. So would a deficient person really be able to manifest that heat? Maybe not. Sometimes they can't. They actually don't have the yang. They're so drained of resource. So what you're saying is a person's cold damp, but then eating hot natured foods results in this canker sores. So what that probably is the person's deficient, right? And then when they eat this hot natured food, it's flaring their yang. That's certainly how classical Chinese medicine would think of it. So what's that heat on the outside? It's their own body's yang kind of rushing to that area to heal it, rushing to that area. Yeah, so there are treatments where we kind of flush things out because of that heat, those heat symptoms, but you can't live on those herbs. You can't stay on those herbs for long term. So that's what, or maybe with acupuncture, it's kind of good at flushing the heat out, but then you need to think about how we're going to make this person stronger so that this flare doesn't happen every time they have the hot natured foods. Hey, that's okay. You can just find my channel now. You can jump in now, Angela. That's fine. You can you can ask a question. So basically, we're asking questions about Chinese medicine. So you can ask a question about Chinese medicine. So this guy here, Krempy Lars, asks, should the Chinese be held accountable for creating COVID-19? I don't know. I think that's outside of my scope of practice. It's a good question, and I think we'd all like an answer to that. I think you have to ask the WHO. I don't know. Look, it's a difficult situation, and yeah, I think the whole world would like to know who's going to be held accountable. So I'm sure if you asked Donald Trump, he'd probably say yes to that question. I don't know the answer. Yeah, awesome. Right. Okay. Good. That's good. That's interesting. Yeah. With this question about this hot and cold, it's something that really was hard for me to understand as a student, and it's only been since I've done the classical Chinese medicine that I've really understood this idea. Maybe because in TCM they didn't explain exactly how did the heat and the cold get there simultaneously as well as I did in classical. Would I recommend any of the Taoist meditation techniques like Dantian breathing, etc.? Yeah, for sure. So you have 5 branches of Chinese medicine. You have herbs, acupuncture, Chinese massage. I've got a little board here. This is not a whiteboard. It's just it's one of my painting boards. But I want to just be able to write this down somewhere so you can kind of see these things. So this might backfire on me. So you have herbs. You have diet. You have Qigong and Tai Chi, or CHI. They're 2 branches. Diet therapy. You have herbs. You have acupuncture. And you have Tuina. Right, so these are branches of Chinese medicine. So I'll just put that there so you can kind of see that. Now, this is a treatment branch, right? So disease has already started when you've got that. I'll just get this thing out of my face so it's not going to be too loud for you. This is a treatment branch, acupuncture. All these things have a common structure of thinking. They think about things in terms of like, oh, wow, I can write upside down. They think about things in terms of Chinese medicine. So how do we get sick? How does disease arise? How do we get healthy? All that sort of stuff. You have Chinese diet therapy, you have Qigong and Tai Chi, or what's sometimes called exercise therapy, that branch. And you have Tuina. Now, I've heard other people say there's other branches. But within this comes into that is the breathing techniques and those things. So these, and even with Tuina, like that has a big crossover. That's why I've put it here, because it has a big crossover with Qigong as well. So how you cultivate your life, like it's called Yang Shen in, it's called Yang Shen, like nourishing life or engendering life, keeping life healthy. So yeah, it's like almost a forgotten aspect. You know, just the same as in Western medicine, you can't really make money off of keeping people healthy. You can only make money off of keeping people sick, or not keeping them sick. Like I hope I don't keep them sick, but treating illness. So I think that's one reason why those two have propagated so much, or maybe because people don't seek the help. And it's good that people are looking for help now. But these things kind of, hopefully, if you keep those, cultivate those things in your life, keep that Chinese diet therapy going, like you have a healthy diet, let's say, and you have proper exercise, you're not over exercising, but within Qigong and Taoist breathing techniques, That also incorporates like mental health, which we see in mindfulness practices now in the West, like these kind of ideas. And that would keep your body in harmony and in balance so that it doesn't get sick. That would be the answer. So yes, of course, you should do those things. The Wim Hof methods of breathing are pretty good. The Buteyko method of breathing is pretty good. If you can find a good Qigong, Tai Chi kind of teacher, those things are awesome. I might have someone on my channel soon doing that kind of stuff. That'll be good. Yeah. All right. So not a question. Maybe I should put that on the screen. I'll just read it out. Not a question. I got injured on the job. I asked if I could visit a chiropractor. Insurance said no. Yeah. Okay. Yeah. Those aren't a real doctor. Well, look, it depends on, one is your insurance company and your country. I'm not sure about what country you're in. I know in America, they're really strict with their insurance. Like certain insurance companies will pay certain things, and that's how it is. I'm not sure what country you're in. So that could be a big issue. Just that, like, so for instance, where I am in Australia, we have a thing called workers' comp insurance, and some patients could come and see me and claim and get everything back, and some patients can't claim anything at all. They won't be acknowledged, and they just have to pay for it all out of their own pocket. And I've had some patients that have had they've just paid for it because it's helping them. And then there's other patients I've had that could get it all covered. It's really bizarre how they kind of think about it. Yeah, it's a shame. And the best thing you can do as a consumer, because that's what you are, you're a consumer and you are their customer, is to make it really clear that they're doing you a disservice by not providing that to you as best as you can. And maybe choose a different provider. Obviously, if it's your workplace, you probably don't have control over what provider they use. But it's in your workplace's best interest to get you back to work as quickly as possible. So you'd think that they would want something that would help you. Anyway, the other thing you could do is maybe look up if you could provide research on the injury that you've had, and there was acupuncture research on that kind of injury. Like, let's say you've got carpal tunnel syndrome from doing something repetitively, and there's research on carpal tunnel, enough sufficient research to show that it's effective for that, then possibly they might pay for it, something like that. Oh, we've got lots of questions coming. Great, guys. This is great. Yes, I'm not sure what the S was. How can we help a cold along besides vitamin C? Yep. So help it on. I think you mean to get rid of it, right? Of course you do, yeah. So there's a couple of things you can do. I'm a big fan, obviously herbs. I use a lot of herbs, and I'll give you some food herbs you can use, so foods you can do. But I use vitamin C, zinc, and vitamin D. And even before coronavirus, I've always used that. Not so much the vitamin D, but vitamin C and zinc. And vitamin C in large doses and a really high, good quality. You've got to use of it. The downside of vitamin C in Chinese medicine is it's really cooling. So it's going to damage your yang eventually. So when you get a sore throat, in TCM, they're going to say that's heat, right? They're going to say, oh, you've got heatiness, so you need to clear the heat. And that's where the vitamin C can kind of come in, and that's kind of good. And there's herbs like things like yin chow san is a formula that's commonly used for that, right? So that's one way of thinking. Now, in classical Chinese medicine, in the Shang Han Lun, which is a textbook devoted to the treatment of colds and flus, they're thinking of, well, what Zhang Zhongjing's thinking of is that when illness comes into your body and you get sick from that illness, it's because your body has an inability to cope with the outside environment. So there's this fight between your body and the outside environment. And that's the fever that you get. So what you want to do with herbs or foods or whatever treatment you're doing is you want to make your body as strong as possible so that then it can fight. Oops, touch the microphone again. So that it can fight the outside environment and then get rid of that. And we don't think you need to suppress a fever unless it's a super high fever. There are Chinese herbs that are very cooling, which would kind of get that fever under control. But in general, you want to promote the opening of the pores, which would promote the sweating. So you'll see in the very first formula in the Shanghanlun, there's two formulas that are used for an exterior wind attack, wind strike. One is called Guizhi, and that's using herbs like cinnamon. Well, it is using cinnamon, Guizhi, ginger. So both of those are pungent and warm. And then there's other herbs in there that kind of help because you're going to be sweating. So you need to kind of contain that sweat a little bit, not let the patient sweat heaps. So it really depends on if the person's deficient or I want to say undeficient, let's say not deficient, at the start of getting sick as to whether they would end up with what we would call a Ma Huang tongue pattern or a Guizhi tongue pattern. And how that would manifest for yourself is not so much the sore throat, because this is before you get any of that. This is just when you feel sort of cold, you actually feel cold and you feel shivery. And you think, oh, I just want to get more clothes on me. And so this is the time when you can intervene with the foods. The best thing to do then is have a really hot curry kind of food, like a pungent, warm, something that's going to kick that out. Now, you see this in lots of cultures. They use chili or curries or things like that. So if you can get hold of something like that, that will be all right. And maybe with a little bit of rice, because that Guizhi tongue formula is supposed to have a little bit of rice with it. And when you put that rice in your stomach, it gives you something to be able to generate makes you able to generate the sweat because you're a bit warmer in your stomach. And then you would make yourself warm. Like you'd go to bed and you'd put the covers on and you would hopefully sweat. And if you could sweat it out almost, like sweat then you would promote the sweating, and that's how the resolving of cold and flu kind of happens in a herbal medicine sense. So if you wanted to replicate that with foods, you're kind of thinking ginger. So I always keep fresh ginger in my fridge. So you could try this. You could try 5 slices of ginger with a teaspoon of honey. So in that formula, that Guizhi tongue formula, there's Darzao, which is a date. It's probably around here. Probably around here somewhere. Here's some Darzao. Right, so Darzao is a date. And that is, there we go. I don't want to yell into the microphone. But these dates are sweet. So when you cook them, they become syrupy. And there's the cinnamon. Yeah. So that would be the general start of it. Now that stuff doesn't really work if it's been going on for a little while, like a week, and now you've got this sore throat and all this sort of stuff. Just drinking a little cup of honey, and this is where you get the lemon and honey. So you've got this sour and sweet together. So that's not really going to help too much. You might soothe it, but that's where I would kind of start with that kind of process, right? So Angela says, I've got honey and ginger honey and date syrup. Yeah, so you could probably kind of start with that. So ultimately, the other thing you would want to do is like make sure you don't overstrain your system when you're sick. So you don't overwhelm it. Like usually when you get a cold or a flu, a lot of people go off their food and they feel like I'm not really that hungry. So you don't need to kind of eat a lot of food if you've been sick like that, because that's going to strain your stomach. So just, stay away from alcohol, stay away from things that are going to aggravate that, and just let your body have a chance to kind of have a rest kind of thing. So you are thinking about, in Chinese medicine, making your body as strong as it can. Now, if it got to the point where it's lingering on and it's not able to get better, there's lots of herbal formulas that practitioners use. And that's where you'd be best off just going to a practitioner and you'd get on top of it a lot quicker than sort of messing about with foods. But the foods can work if you catch those things when it is super early. And so you have to be aware that you wouldn't have a sore throat, you wouldn't have a fever necessarily. You might have a bit of a fever, or you might feel a bit under the weather and you think, oh, I might just check my temperature because I'm not sure if I have a fever. But you just generally feel cold. You feel a sense of coldness and you want to lie down, you feel tired. Awesome. Here's a great question. What do you think of Master Tung's acupuncture points? Tan or tongue? So tongue, I've not used that myself too much. I do use the Dr. Tan method quite a lot. The tongue ones, I just don't use them a lot, but I think they're probably good. And I think that's also based on a mirroring system as well. And they're, really minute points. In the last 3 or 4 years, I've really focused on herbs much more than acupuncture. So I probably haven't gone and done a lot of specialized stuff, but I know a lot about different things because of my teaching, but I don't know a lot about tongue. So yeah, but I think it's good. Should people with chi stagnation and blood stagnation avoid treatments? No, probably have those treatments more than avoid them, because they're going to remove that stagnation. So it's more people that are really, really deficient that would have to avoid those kinds of things, because they don't have much yang. And so when you have those kinds of treatments, they stir up the yang, or they might disperse the little bit that they've got there, and they can sometimes feel really, really tired after a treatment. So if you've ever gone to a Chinese medicine person, an acupuncturist, and you've had a treatment, you come home, you feel like wiped out afterwards, you feel so tired or sick, even that sometimes that's because either you're getting a cold or a flu and your body then responds to that and makes you feel super duper tired and you've got to lie down, and then you wake up the next morning and think, oh, I am coming down with something and I'm sick. Because acupuncture can often propagate the process that heals your body. So it makes you feel very tired if you kind of need to heal yourself. But if you've got super duper back pain and it's really tight and your pulse is generally what we would call not deficient, but let's say just moderate wiry, and it wasn't a deficient kind of wiry, then often these treatments would kind of be used. And the more robust people tend to get these things. So yeah, you can get chi stagnation from deficiency, but it won't manifest in the same way as that person. So if you have cupping and you get bruisey colored marks, big bruises, you're generally a stronger person, a more robust person than someone who's deficient. The more deficient you are, the more the pale marks type of marks come out. And again, it depends big time on what kind of exercise you're doing. If you go to the gym a lot and you're stretching, you're constantly producing stagnation from doing that because you're building up lactic acid. I'm not saying don't go to the gym, but if you're doing that, then, and that's why athletes often get these huge marks. The Olympics are coming up soon, so we'll probably see that again. People jumping into the water, getting all the marks all over their body. That's like seeing the Olympic swimmers. Those people are super robust, and that's why they've got such strong marks. So yeah, I'd say no, they don't need to avoid that. But in general, just check with your practitioner. Everything's, you can ask your practitioner, and they should be able to give you a legitimate answer for it. At least explain, answer you, give you some kind of answer. Angela says yes, in the USA. So that question we were asking before about your injury, yeah, I'm glad you found my channel too. It's such a minefield, I think, for you guys. There's so many different rules with different things. Yeah. Oh, this person's really nice. Sorry to hear about that situation. A lot of people are fairly biased, ignorant. Yeah, they are. And sometimes people will change. I think I'm of the opinion that things can change. Nothing's set in stone. We can change it. And if we don't have that opinion, the opposite of that is a terrible society. And I don't want to be in that kind of terrible society. So I'm constantly battling things where I know I probably won't win. But I feel like if I don't even try, what's the alternative? Just living in a place where like no one listens and nothing changes, you know. So yeah. Okay, good. Glad something I've said tonight makes sense for people. Oh, can you talk about mother-son theory? Okay, sure. Here's my handy chart that I made that I've just bastardized with the other thing. We need this to talk about it. This is not a whiteboard. This is permanent marker, so it's not. I haven't done myself a service here. All right. So you have 5 elements. Oops. I'm gonna have to try to see if that can stay in there. Right. You have wood, fire, earth, metal, and water. And the mother-son theory. Someone's laughing. That's good. The mother-son theory is like wood generates fire. Fire generates earth. Earth generates metal. Metal generates water. Water generates wood. So what does that mean? It means it gives birth to, or it's the mother of. So that's what. So this is often called the generating cycle, which goes like this, right, in a circle. So you just, if you're learning TCM, you always just have to memorize. And most people start with wood, and you think wood, fire, earth, metal, water. Now this kind of makes sense when you think about the other things that it relates to. So if you're a first year student, the other thing I want to mention, which is important, is Chinese medicine is a multi-layered kind of system, which a lot of knowledge is kind of pinned on the other knowledge. And there's almost like no place to start. I often have students after halfway through first year or even second year, they're like, what? Especially in second year, they're like, why didn't we learn this before? It would have been easier. Like life would have been easier if we'd learned this last year. And I'm like, we couldn't learn it last year because you were learning this last year. And what we're learning today isn't going to make sense because if you didn't learn this. And then they're suddenly thinking what I'm learning today is actually making this make sense. And even there's been times where, like, I've been doing this for 20 years this year. I don't really want to say that out loud, but I have. And so when I first started studying Chinese medicine, I was 17. Yeah, I was turning 18 that year. And I remember being so confused, bewildered, thinking some of this makes sense in terms of it just sounds like common sense, but some of it just sounds like woo-woo and weirdness. So how can I make sense of this? Yes, I understand. So what I'm getting at is just stick with it. Like just try to stick to it, and it will make sense. It kind of just fits in. And then one day, like there's been times when I've been teaching, that's what I was thinking of before. And even just a few years ago, I was teaching something, and I remember doing it in the class, and then I'm thinking, hang on, this totally makes sense to me in a different way to what it did when I learned it or when I was even preparing the class or something. So it's something that kind of, one is you never waste that knowledge because it doesn't change. Like this theory is never going to change. It's always been there. It's been there since the Han Dynasty. It's always going to be there. So you're not wasting your time with learning it. So this is basically saying these give birth to each other. And if you think about them in terms of the seasons, that's also a part of it. So wood is related to spring, then that leads into summer. Summer leads into what they call the late summer, which is the earth. Metal is autumn or fall for the Americans, and water is winter. So there's a transition going on, right? So this is giving birth to these things, to the seasons of life. The 5-element theory is used often metaphorically for things as well. You could think of it in terms of emotions generating each other. And how this is used in acupuncture, I'm assuming, Tamara, you're in acupuncture school, that it's often used in a treatment sense. So, for instance, if you want to treat a fire element like the sanjiao or the heart, then you might tonify the mother to treat that, or look at like maybe the mother isn't generating the fire. So if wood doesn't generate fire, so you can think about it like actually like a fire. So how do you start it? You can't start a fire without any wood, right? You need fire. You need wood on the fire, wood to have the fire, right? Fire generates earth. So when the fire burns out, what's left? You've got earth, right? The ash. Earth generates metal. Well, that's where we get the minerals from in the environment. Like they come from the earth. Like over years and years and years of time, that's generating the metal, and then metal generates water. I'm not sure how metal generates water, but I'm sure that physics it does. And water generates wood, right? So this is a really good one to think about in terms of nothing's going to grow. Like an idea of like if you don't have water nourishing wood, then wood gets stiff and stuck and dies. Like the tree dies if water isn't kind of generating it, and water isn't. And you often see this kind of like, here's the tree. That's the terriblest tree you've ever seen. It's like a cactus. Here's the water, kind of, and this kind of idea of these things kind of generating, and the sun, coming in and doing that. So thank God that picture's really tiny. I'm going to answer some other questions now. Okay, so we've got heaps here now, right? According to TCM, is white mulberry or eggplant good for the lungs, while black mulberry or eggplant is good for the kidneys? Different colours of the same thing is good for different organs. Yeah, so this comes from an idea called the doctrine of signatures. And this is a thing in herbal medicine, like not just Chinese medicine, but just general herbal medicine. So if something looks like something, it can tend to help that something. Like in Chinese medicine, white belongs to metal. So the lungs, so any vegetables that are white, like I've recently made a video, I haven't had time to edit it yet, but it was a soup recipe for winter. Like I'm in winter here in Perth now where I live. So I was using like turnip, parsnip, particularly, turnip and parsnip are white, and cauliflower, like white vegetables to kind of nourish the earth and the metal. So root vegetables, because they're grown under the underground, they always nourish the earth. But if you've got a root vegetable that's white, like a turnip or a parsnip, that's kind of like, it nourishes the earth, but it also has an effect on metal or So your question about is white mulberry or eggplant. So I'm not sure about white mulberry just because I've never even seen one. Like we don't have them in Australia. I've never seen them. So I've not experienced eating them. I'm sure they're probably just as juicy as a normal mulberry, and that juice like typically would be good for moistening, and your lungs tend to be affected by dryness. So mulberry tends to always, like black mulberry is definitely for your kidney, and blood, like tonifying blood. Mulberry is one of the best foods you could have to tonify blood, I think, because it's so juicy, it's so moistening. And when people get blood deficient, eventually they get blood stagnation, they get dryness of blood. So I hope that's useful for that answer. We'll quickly I won't be able to quickly do anything. What would you add to this sleep tea blend to make it balanced? Oh, that's a good question. Rosebud, chen pea, and cinnamon. Right. I could probably make that up right now. I've got some of those things right here. I've got some rosebud here. I've got some chen pea somewhere and some cinnamon. So what do you want to... Oh, sleep tea, you said. Okay. I don't know whether I'd have cinnamon as in the sleep tea, because cinnamon is a wood herb. I'm not saying we would, like, let's say in herbal formulas for people with sleep problems, cinnamon can still be in the formula for sure. So I'm not saying you can't have it, but it's generally a stimulating herb, right? So it's moving wood. It's generating wood. You probably don't want to generate wood right before you go to bed. And certainly it's tends to be good for like cognitive thinking, sharpness, that kind of stuff. If a person was really cold, then possibly cinnamon might be still good in there. But that kind of tea doesn't really sound like a sleep tea. Like I would have that in the daytime tea. Like rosebud could be good in the sleep time. What else could you put in there to make it balanced? So you've got stuff to move chi. You've just got like Chen Pi is a moving chi form herb, and it also helps with damp, so it kind of dries damp or moves chi. And its aromatic nature, that pungent nature, is kind of moving. I wouldn't actually have those two things in a sleepy tea. Maybe you're having that and you can fall asleep. That's good for you if you can. But I probably wouldn't make that up as a sleepy tea. So sleepy time tea, you want to have things that are like either peppermint can be good because peppermint helps your digestion, and some people have bad sleep because they have digestive problems. So maybe Chen Pi could help it from that perspective because it might help your digestion. So particularly if you had sleep where you couldn't fall asleep because you've overeaten at night, then maybe the Chen Pi would do that. What else would you put in? What else could you put in there? Let's have a think. Sleep. Oh, Dardal, of course. This would be one of the best ones. So Dardal is like, we're talking about signatures and stuff before. This is, the lid always gets stuck because it's, here we go. So it's like a heart. So these are cut in half ones, but I'll put them together. So I'll just pop down from there so you can. If I get my face out of it, then it will focus on that. There you go. So it's like a heart, right, which is fire. So Dardal, and because it's sweet has a relaxing effect. And that's what you want before you sleep. Not sugar, like as in, you don't want to have tons of sugar before you go to bed. Bang that mic again. But yeah, you want to relax. So I would put some Dardal, maybe put some Dardal in that. If you have that. Or if you don't have Dardal, you could try a little bit of honey for that sweet relaxation kind of effect. Okay. Can we talk about the 5 shoestring theory? Maybe. It's a big thing to talk about. I might come back to that. Black foods are typically good for Jing, and there's a bit of a thing with the color of the foods. Yes. And I did explain it. Thank you. But yeah, black foods, why are they good for Jing? It's because they're good for blood. So a dark, you can think of like mulberry, blackberry, blueberry, all the berries basically. So even if they're red berries like raspberry, they can maybe have a bit more affinity towards fire or something, but they tend to tonify blood. And because they're sweet and succulent, kind of, juicy, that kind of stuff is good. The other things that can help with blood and Jing so particularly Jing would be walnuts are really good. They look like a little brain as well. So that doctrine of signatures, you kind of think of like one of the things that Jing has a connection to is your brain, like your marrow through that. So, but yeah, the black foods are like that. Trying to think of some other ones. I did make a video for vegans on blood deficiency for vegans, and I was talking about those darker foods, darker vegetables on that one. Yep. Starting to understand and completely grasp the generation. Oh, that's good. I'm glad that made sense to you. I'm sure it's probably your teachers that have made the sense of it. Yeah, the 5-element theory does make sense, right? And that's what kept me in Chinese medicine for so long, is because I always found it sensical. I was like, I couldn't move away from it because I was like, this just makes sense. Like, it just makes sense about how we are in the environment and how disease happens and how illness kind of arises. So I love that. I love it as well. Yeah. Well, good on you. I hope you continue on in your studies, and good luck with your studies. There's nothing better that you could study, I reckon. It's such a great profession for yourself and your society and humanity. Yeah. Yep. Has it been asked if people should I don't know if we can I don't know if I can answer these questions, guys, because of various reasons, which I probably can't even go into the reasons for. So we'll just skip on to that. I think, okay, so I will talk about this a little bit. You have to make your own decision about your healthcare, and you should discuss with your doctor or your healthcare practitioner, whoever your healthcare practitioner is, not your YouTube healthcare practitioner, like not me, about your individual, what's right for you, because there's a lot of factors that go into it. Like there could be factors where you have, a history of previous illnesses and stuff like that in your family that might make you susceptible to particular adverse effects from any kind of vaccine or any kind of like treatment that you have. And it's only really your doctor that's going to kind of have that knowledge, right? So that's one thing. And, secondly, like no matter where you are in the world, like any medical treatment, I made a video on this about 2 months ago about principles of ethics in medicine. So there's 4 principles of ethics. One is autonomy, which is the right for you to make your own decisions about your healthcare. And within autonomy comes what's called informed consent. So you have the right to informed consent. Now, these are universal principles agreed on by all medical people. They're taught in schools. I've taught this to students in classes for years and years and years, nothing to do with the coronavirus, right? Like it should be free of coercion, right? Like your medical decisions. And what respecting a patient's autonomy means is respecting their right to choose, even if the doctor doesn't think that's right. So let's say you go into your doctor and you say, I want to know about blah, blah, blah treatment. And they say blah, 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 blah. And you go, stick it up here. I don't want to take it, or I don't want to do it. Well, they have to respect that, even though the doctor might say, well, you're going against medical advice or, whatever. And they'll say, like it happens a lot with patients that say when cancer treatment or something like that. So the doctor might say, this is the recommended course of treatment. And you might say, I don't want to do that. It's your right to choose whatever now you obviously going to that doctor or that health professional because you trust them somewhat, or hopefully you trust them. And you want their opinion. You want them to want to know about that. I've never experienced ever in my whole 20 years of practice, I've never experienced a situation where the governing body, now we've only been with APRA, which is our governing body in Australia because before that we were just free, let's say. We weren't governed by, they've basically introduced a governing body, and we have one of the highest standards in the world now of like what they will accept for practitioners. So we've been with them for I think 8 years now, and I've never experienced a situation where they've told me in a letter what I can and can't say about a particular thing. And they have sent a letter to all healthcare practitioners saying, we don't want you talking negatively about the Australian vaccine rollout, or not about the vaccine rollout, I should say. Well, I can't remember the exact words, but basically about the vaccine. And so that concerns me, just them interfering in that way, because I'm not a Western medicine practitioner. I'm a Chinese medicine practitioner. And I've also never experienced a situation where in such a global sense, there's just like no one's thinking that there are other systems of medicine out there, like no one's acknowledging that. And that is my whole business, is the system of Chinese medicine. Such a great system. So I said I wouldn't talk about this, but I've already talked about it. So I think that's probably enough. But it's up to people to make their own decision. And I think you should just be free to make that decision, whatever that decision is. You know, like I'll support my patients, whatever decision they want to make. But the point is, you should be free to make that decision, free of coercion. So I heard how metal generates water is because of, oh yes, that's true. You're right. You should be running this channel. I forgot that. Yes, condensation on water. Yep, metal, like exactly. So if you want to get water in the out of the atmosphere and you're stuck in the bush, you put some metal out, right? You put something metallic or like even plastic would be the same kind of thing, and then the condensation will come in the morning. Yeah, good one. Why does poop change color? What a bizarre. It's not a bizarre. I'm not laughing at your question. It's just a bit out there. Just that these questions come in all shapes and sizes, like no pun intended. Yeah. Okay. So poop color can change because you've eaten certain foods, and it may not be something wrong with your body. Let's say it's just your body. So obviously poo is the waste that's being digested. So think about kids, right? Like if you ever changed little kids' nappies, or you can remember as a kid, like I remember as a kid just eating a ton of mandarins because we had a mandarin tree. Me and my sister used to put all these mandarins in these, like we just go around in our little bikes and collect up mandarins and just eat them. And then we would be pooing out just seeds, like literally mandarin seeds, because we've eaten so many. And, you know, that teaches you a lesson. You're like, oh, I've got a tummy ache. And mum's like, don't, I told you not to eat so many mandarins. And we also had a plum tree. So we would do the same with the plums, but you weren't pooping out plum seeds. So your poo does change color by if you've eaten something that you like that might have a pigment in it or something like that in a color. What you sort of have to worry about is when it's changing color and nothing in your diet has changed that you can identify. So you might want to go into like what we call that clear bland diet again and just see if your poo changes. Goes back to sort of, let's say, a normal color. There is a thing called a Bristol stool chart, which you can use. It's a thing you could download off Google or just find it, have a photo on your phone. So you can kind of identify the shapes of your bowel movements and what's sort of normal. So somewhere between kind of constipated and loose in the middle is this, what they call the soft sausage. That's the normal poo shape. So why does poo color change? It can sometimes be a liver problem, like you could have lots of bile pigments in your body. There could be lots of reasons why it can change. So you're probably best off going to a doctor, a GP, and having a test if that's the case and you're not sure what's happened. But in Chinese medicine, they don't actually have a thing where they're like, oh, if you have green poo, it means this, or you have blue poo. Not that anyone has blue, but yeah, it doesn't mean something in Chinese medicine like that. With poo, we more think about the constipation and the diarrhea situation, right? Any tips for getting sleepy? Getting sleepy, drinking something like honey water. Does warm milk actually help people sleep? Okay, good questions here. Doing a live stream at late at night, it's like 11:30 p.m. for me now. Could have made me sleepy, but I'm actually really wired now. I'm like, as in I'm awake. So no, don't do a live stream at this time of night. But this is a good time to catch people. That's why I'm doing it now, because I'm on the other side of the globe to most of you. So warm milk is a thing called tryptophans. So tryptophans are activated they're in turkey and they're in warm milk. So that's what makes you sleepy. That's why warm milk makes you sleepy. And it's almost a hypnotic effect. Like, have you ever seen a baby that gets that milk drunk look? You know, those milky eyes, milky eyes, and they're all sort of sleepy and drunk on their milk, right? And that's what happens when you have Christmas dinner. If you have turkey, you get this tryptophan happening, which kind of helps you feel good, feel sleepy. I wouldn't recommend warm milk from a Chinese medicine perspective, just because milk can make you so damp, probably not the greatest. But if there's nothing else you could do, you could, I guess if you were desperate, you could try it, right? So there's a couple of things that you have to think about for sleep. Phones and screens and all that, right? So the screen thing, every time that screen lights up, every time you're looking at screens, you're signaling your body that it's daytime, and that's stopping your melatonin production, right? So what melatonin is naturally getting produced. So if we think about in Chinese medicine, really, break something here. I'm going to flip this over. Oh, I thought I didn't have anything written on there, but I do. So I'm just going to draw a real simple yin-yang Tai Chi. A bit of dark one. So what that's telling you is that night turns into day. So what you're trying to achieve, what you should be trying to achieve, is like this transition time. And because of natural forces, let's say the sun literally stops or goes away, like your body would naturally be winding down towards, I don't think we would be staying up as late if we didn't have electricity. I don't think we would be as wired by things because we wouldn't be able to see, like you wouldn't be able to engage in stuff. So just think, I'm not saying, okay, the way to fix your sleep is to become a caveman or turn off your electricity. But you have to kind of think about these things somewhat like that in a way to kind of think, okay, how do you reverse engineer that? Because it's not about what you have to do. Sometimes it's about what you have to not do. And part of this problem in like our society is called, in classical Chinese medicine, they call it taxation. So what that means is you're just overworking your body, just overworking your mind. And it's not just physical taxation. So I think in the Han Dynasty and later than that, especially when you see like people say, you know, TCM, or you get kidney deficiency from overwork, they had a lot of physical taxation because they didn't have the things that we have in our times now that enable you to do jobs where you're sitting. So in order to earn a living, you had to literally break your back, like you do back-breaking work in a rice field or hoeing stuff or building something, physical hard labor all the time. And so that's not great for you either. But sitting around and in just being on computers and stuff all the time, maybe that's not so great as well. So how do we solve the problem? Is kind of being aware, I think, firstly, of how much stuff you're doing in that transitional time towards sleep. Are you doing things that are going... So I wouldn't say necessarily just... Okay, so for me, I don't know if this is how you guys feel, but when you go on Facebook or YouTube or something like that, so probably not so much YouTube, but Facebook and Instagram and stuff, like you go there, you open it up, let's say 9 o'clock at night, because you're interested, you're intrigued, or your brain is like, entertain me, or you're just bored, or sometimes it's just a habit. You just think, oh, what will I do? I'm watching TV, I'm going to press this on. And then next thing you know, you're like sucked into this world of things being suggested at you and things like that. But not just that, but you're emotionally invested in this stuff. Like you see things that make you angry. Oh, why are these people doing this? Johnny said that. Oh, someone sent me a message. What could that be? And your curiosity is kind of sparked. So what I'm getting at is your brain is on. Your brain's on. Like more than just, it's very intrusive into your mind. So if we could train ourselves to kind of get away from that, I think that would be better. And I'm talking to myself as well, because I have to tell myself, don't do that. Don't turn that on now. So you have to kind of transition towards that. That's one thing. Now, another trick for sleeping would be blackout curtains. So ultimate sleep, like the best sleep, is giving your brain a complete rest. So not having sounds, not having flashing lights. So if you live in a busy area and lights coming through your window, you have traffic out there, beeping sounds, that sort of stuff, you can get headphones, like noise cancelling earplugs, or headphones or something like that. Earplugs is the best thing. I know some of my teachers that sleep like that because they travel quite a bit, and you're in hotels, and I've been in hotel rooms before, and you're just in a strange place, and then there's someone's entering a fucking bin at 3 a.m. next to your hotel room. You're like, why are you doing that? and it's waking you up with their beeping sounds and things like that. So I think you have to be aware of like mitigating those circumstances before you start saying, oh, I'm just going to massage this and do that. Now we'll get to the points. So the next points you could use are on your wrist. So here, see the crease of your wrist. I'm going to move that microphone. We'll just put a dot on them so you can kind of see. So I'll often tell patients to like put that in front of my face and you can kind of see it. Massage the crease of their wrist. And if you go in the middle, that's pericardium 7. Go to the side. This is your lung channel, so that's lung 9, and this is your heart channel. So if you just go, you can either just rub across the crease of your wrist like this. Sort of, it's hard for me to show, do and show you, but like that sort of a thing. I need a where's my little fake hand when I need it? Got this little claw hand that I had from Halloween. This little fake hand. But yeah, so you just rub across there. Now, so you've got pericardium 7, heart 7 on this side, and it's just right at the crease. So you can find those points. So you think pericardium 7, heart 7, lung 9, and really just in those spots. So you can go down a little bit, pericardium channel. So that's your, I was thinking that diagram was there. So your heart, your fire element. So that's kind of calming your mind. You can use these points. So Tai Yang and Yin Tang. So this is Tai Yang here and Yin Tang here at the top. You can do this squeezing method. So you basically pinch here, pinch between your eyebrows. Another one you could try is on the back. There's a point called An Mien. It's hard for me to show you because I can't I guess I can't really show you properly, but I'll turn to the side. So gallbladder 20 is here, and behind, like anterior to that, so in the front of that is where the An Mien point is, A-N, M-I-A-N. So that point might help. You can use a little bit of lavender oil on those points. If you're not allergic to lavender, you could try that. So I'm going to have to start winding down too soon talking about that. I don't have to work very early in the mornings. That's why I thought I'd do this live now, because I like to catch people on the other side of the world. And so short of me being up at 2 a.m., which is 7 p.m. in the UK time, I don't know. Okay, so we've got so many questions. Wow, this is good. Anything that can cure jam stomach, Pootie not coming. Not sure what that means. I'm going to move on. I'm so thrilled to catch you live. I'm so happy you're here as well. Yes, it depends on the quality of the type of cinnamon. Yeah, that's what I was mentioning, trying to think of before. There's just so many breeds and styles, strains or species. That's the word, species of cinnamon around. I live in Los Angeles. Is there a TCM practitioner you would recommend? So my system of herbs is called ICEAM, Institute of Classics in East Asian Medicine. There are some. Am I going to post this live? What does that mean? Like it is live. You mean put it up again? Like it'll be up on YouTube and that in perpetuity, like hopefully, unless YouTube takes it down. Maybe because we were talking about the vaccine, it might be taken down. I don't know. But I will try to put it on. Is there a TCM practitioner I'd recommend? You can send me an email at, the best one at the moment would probably be Chinese Medicine Podcast @gmail.com. And I'll ask within my network, because some of those practitioners in ICEAM, they don't have, if you go to their website, there's not everyone who's a practitioner is actually on the website, but you can go to that website, iceam.org, and I think it's .org. There's some people who've completed the course that are on there, but there's not like a definitive list. So I'll have a look. I can't think of anyone right offhand right now. I'd have to have a quick search, which I can do as we're talking. That would be, and lots of those people, they do that. They'll do that system of herbs, and they'll also do acupuncture as well. Here in the US, people get free jabs at the local Walmart pharmacy, CVS pharmacy, etc. While people struggle to get their diabetes met. Yeah, it does. Something doesn't seem right, doesn't it? Because if they were really thinking about health, well, I know in Australia we've had a bit of, like, there's obviously a time gap between when it happened and when the vaccine comes, right? And so all we've heard that whole time was, we've got to wait for the vaccine, shelter in place, and all that stuff. Until the vaccine comes, and then it's like, the vaccine's going to come and the savior of us all, right? But all that time while we've been so-called waiting for the vaccine, there's not been any information about how to keep people healthy or tell fat people to lose weight or anything like that. I mean, I took it upon myself to try to lose weight. Like, I could lose some weight, right? Like, but the government hasn't told us that or mentioned that. They haven't done anything to sort of say, well, we need to help people with chronic diseases get better. Or, yeah, you're exactly right. There's something not right there. Yep. For someone with dampness, do you think having goats or sheep milk, cheese or ghee will generate more dampness? Yeah, look, this is a good question, and it is really hard to exactly answer it in a way, because for some people with damp, they just have to stay away from all of these things. The best thing you can do is get your body as healthy as you can, and then try one or two of these foods and see how you go. Now, often goats or sheep cheese is less dampening than regular cheese, right? And how you'll know that sometimes is the taste of it. So and the look of something. So if it looks creamier, it generally is more dampening. I did a whole video on cheeses. Like, I did a cheese lineup, and I talked about hard cheeses and soft cheeses. I didn't do too many goats. I don't think I even had any goat's cheese in there. But yeah, I think ghee is probably better than butter by itself. And certainly it seems like it's a healthier way. Like, it's very big for Indian diets, and Indian and like Asian diets generally are much healthier than typical Western diets. But it's not because they have ghee or excuse me, because they have this or that. It's sometimes because they're having that stuff, but they're also not having all this other stuff, right? So they don't tend to have as much processed breads, like they'll have grains as actual grains, like as rice, rather than like, most average Western people eat loaves of bread, like lots of bread. They have sandwiches all the time and bread. Like, I was brought up on bread. That's what we had. We had sandwiches for lunch, right? And that's what you have as a kid, and then you just keep on having that. And it's just a big part of the diet, and I think that's part of what causes the damp. So sometimes it's not just one food, but how that interacts in all the stuff. Yes, I'm going to post. Am I going to post this live? Yes, it'll be there if I can make sure it's there. Can you speak about the effects of coffee, especially on the stomach and the kidneys? Does coffee weaken the earth? Yeah, coffee, this is a good one. Okay, so coffee has two effects on the body. I'm going to flip this around. Oops. So coffee affects your earth and it also affects your wood. There's a big difference in coffee, having coffees in terms of one coffee versus several coffees. So one of my teachers, my main teacher in Chinese medicine, I always remember him saying, it's okay if you have like one coffee a day, but if you have more than that, then you'll get these detrimental effects. But then there's some people that can't have one a day. They're almost like a coffeeaholic, right? Or it's like almost like, with some people like with alcohol, if they have one drink, then it leads to a lot of drinks they can't stop. So if that's you, then probably try to get off it and don't have it at all. So what does coffee do? One is it's a bean, and beans tend to be cold and they have a descending action and they're going to push everything down. And that's where you get the diarrhea effect or the laxative effect of coffee. But on the other hand, you're roasting the bean. So you're warming this bean up. So you're warming this really cold bean. Now, I don't know if you've ever had this thing called green coffee. Once I had it, it was like a craze that came through saying you could lose all this weight on this green coffee. So I bought this stuff. I bought these sachets of this green coffee and you made it apparently like normal coffee. It just gave you the runs. Like it gave you diarrhea. And I also bought these green coffee beans, and these people were saying, oh, you can just roast the green coffee beans and make coffee out of like unroasted coffee beans. Not only does it taste bad, they're so hard. The coffee beans are literally so hard that it broke the grinder because it just couldn't grind. So what's the roasting process do? Well, it's softening that bean a little bit, obviously, because it's not as hard to grind it, but it's warming it. So it's putting this warmth in there. And you're drinking this product warm, that's going to make a difference. But you still, even though you've changed all these natures of this product, you still can't get away from the actual nature of the product, which is a bean. And beans, like, well, if you follow the paleo diet, you shouldn't have beans, right? Because they're detrimental. They're detrimental to your digestion. And they have that descending and that purging action. Now, sometimes you want a purging action. So if you've eaten a big meal, this is where Italians probably get it right with the coffee. They have this like little short black at the end of the meal because you've had this big, rich meal, typically probably a very dampening meal with pasta and whatnot. And then you have this short black that you have down at the end of the meal. That's a great time to have coffee. Having coffee on an empty stomach can often, especially if you're having onto your second or third coffee, then you're going to have a lot of purging and you're probably going to get diarrhea or loose stools. I have some patients that went off coffee and then they just had constipation because their body had gotten so used to it. They were not having so much diarrhea or loose, but they ended up having constipation when they stopped having it because their body was used to this constant purgative effect that the coffee bean is having on them. And there's also a different effect if you have coffee with milk or black coffee. So that's a whole nother story, right? So if you're having, let's talk about this. So the effect of coffee on the stomach, we can say the yang ming stomach is connected to the large intestine yang ming, right? Because they're both yang ming organs. And that purgative effect is what's happening. So I don't really think coffee affects the stomach. Like it doesn't it's not like hot and damaging the stomach or something like that. It's just a job for the stomach to do. It starts digesting it, but that purgative effect really happens in the intestine. And what's a purgative effect doing? It means it's purging everything out that's in there. So if you're taking a lot of tonification things, we typically say you need to stay away from purgative things because you are kind of doing the opposite thing. You're trying to tonify, you're trying to hold in or hold things in your intestines long enough to absorb things, not just sort of push it all out all the time. So that's one thing coffee does. Now, the other thing it does is it obviously has a stimulation effect on your brain and dilating your blood vessels, like caffeine dilates your blood vessels and, making people feel more alert and that sort of cognitive, and that's an effect of wood on fire. So it's producing this peristalsis. Well, sorry, I've gone a step ahead, but it's producing this movement. So wood is all the movements in your body. And you need wood to generate fire, right? So you wake up in the morning and you know, if you feel a bit sluggish and you're just like, oh, I can't really get going. A lot of that is, in TCM, they say liver qi stagnation. So there's not enough wood to generate fire. So people have a coffee. Oh, I feel good. I feel like my wood is generating my fire and I'm good. I'm good to go. And then you have this slump and you're like, oh, I need another one. So you have another one. And all the meanwhile, while this wood is generating the fire, it's also because it's increasing that wood. Well, one of the things wood does is peristalsis, so this movement. And that's where I think that purgative movement comes in, partly because the natures are being, and lots of things with diet therapy comes down to quantity, not necessarily the actual, you know, you can have a detrimental effect after a certain quantity where you wouldn't have that with a small quantity. Now, if you're very, very deficient, then you might be affected by that detrimental effect really quickly. Like I've had some patients who've told me if I have one coffee, I have to run to the toilet. Like literally I get the run straight away or get the urge to go really quickly. So that tells you that their earth element, their stomach and spleen, let's say, or their digestion is weaker because it's really easily stimulated by that so quickly. Awesome. So, hi, Character Matters. Haven't seen you for a while. Good to see you on the live, on the show. What is drowsiness considered to be in Chinese medicine? So a lack of fire, a lack of yang. There's a few things where you could think about that. And this will probably be the last question unless anyone's got anything burning, a burning desire for a question. Thanks, everyone. Thanks, Alex Chen, for your comments. Thank you, everyone. So I will answer this drowsiness one. That might take, hopefully I don't get too sleepy talking about it. So drowsiness is cognitive, like being cognitive and having thoughts and clear thoughts relies on a few things. It relies on clear yang to rise. So one of the books Bob Flores wrote was called Arisal of the Clear, and this is talking about your digestive system, like your spleen and stomach as a cooking pot on the stove and this kind of thing like that. So sometimes people mistake drowsiness for like foggy headedness, and that could be dampness, literally blocking that clear yang from kind of rising. It could be just simply being deficient. Now, you could say you're yang deficient, just generally deficient would be yang deficient. Or in TCM, spleen qi deficient or blood deficient, just general deficiency. It means your body can't generate the substances that it needs to. So it just kind of lacks stamina. Drowsiness, like I think what you might mean by drowsiness is like this. This is a specific symptom in Chinese medicine. If a person needs to lie down in the day, like they feel so tired that they need to lie down, and that's a kind of a Shao Yin kind of symptom, which relates to your kidneys, and like that, as in that would be like a true deficiency kind of problem. If you feel better from exercise, right, you are generally able to do the exercise because you've been able to do it. So there's a difference between a person who just hasn't got any energy to do the exercise at all. Like they're like, well, if I could get going, I might feel good, but they're just like, oh, I can't even do that. I'm so depleted, so tired. So drowsiness could be considered normal at certain times of the day, right? So we'll go back to this little guy over here. And like it's when this yang is kind of, so this is yang, it's kind of transforming into yin, that's kind of normal, right? Like, so what's happening is as yin is starting, I haven't drawn this exactly right because that should be there should be less, like yang is kind of getting less as yin is growing. So what that's saying is day is declining as night is growing. And then as soon as night happens, night is growing, yang is starting, yin is declining, right? So you could just say that drowsiness is a lack of yang. Now, it's normal to have a lack of yang at certain times because you don't need a lot of yang at night. Like, you shouldn't be cognitive and alert and going at 2 a.m. You should be winding down. So having that regular cycle of yin and yang flowing in and out, all that sort of stuff is pretty normal. So you, on one hand, you could say, well, drowsiness is just a lack of yang that's happening at the wrong part of the day. So it would come down to the pulse of the person, and it would come down to a few questions like, do you feel better after exercise? So if a person feels good after doing exercise and it kind of gives them a bit of a boost, and they're like, oh, it was so hard to get going, I didn't really want to do it, but I felt good for doing it. Well, that's more chi stagnation. Like, you've got blocked energy, you do the exercise and you feel good after it. You feel better. Whereas if you're really, really, truly deficient, your pulse will be so deep, faint, like hard to feel, not much substance there. Like, there's within the blood vessel. So let's say this is your vessel, like for your pulse vessel, your blood, your hand. That will itself will be deficient. That itself there won't be any yang to create that pulse. So it feels deep. It feels like, some descriptions would say forceless or weak or faint. So weak is one kind of depletion, and then faint is an even more kind of depletion of it. So yeah, I hope that's interesting and helpful to you guys. And thank you so much for your questions. I will try to do more of these at different times of the day or night. And this is obviously a good time. I can't resolve my digestion issues. This is not me. I'm reading the comment. Slow digestion, constipation, mental fog. What herbs, foods do you recommend? How long does it normally take? That's a good question too. It can take a while, and your best option is obviously to get in contact with a practitioner and get them to guide you, so that you're doing these things over you're going to have to do this stuff over a long period of time, and you don't want to be just sort of doing the wrong thing or not doing enough, whatever, over that period of time. So going into that, like, get that, if you want to sort of get started on it yourself, you could get that book, the Bob Flores book, Healing with the Paul Pitchford book, Healing with Whole Foods, got lots of recipes and things like that in there, and that's all cooking from scratch and a lot of vegetarian kind of recipes and all that kind of stuff. The other book is the Bob Flores book. So many books down here. The Tao of Healthy Eating. There we go. This is another one that I recommend for people just to understand the basic of digestion. But if you've watched my video on this channel, it's a bit of it's the one with the most views, actually. It's called Why Eat Mostly Cooked Foods. It kind of talks about what's in this book in a nutshell. So you start with that cooked foods diet, right? And you sometimes, to get your digestion going, you sometimes can use a bit of massaging. So if you go around in clockwise like that, I'm doing it really sort of weakly, but you could do it like this, around and around like that. And for some people, I've used that with some patients that have real sluggish digestion, like they find it hard to go in the morning. Maybe using a bit of that coffee. I'm not suggesting you have a lot of coffee, but that purgative effect that is going to generate some of that wood movement, and that can sometimes help people to get going. It would just the advice would depend on your pulse and your diagnosis. Like, so what's your TCM diagnosis in all of that? But you probably aren't going to be able to. You won't go wrong having that clear, bland diet with lots of moisture in there. So sometimes with constipation, if you think you've got slow digestion, it might not be a lack of moisture. It might be a lack of peristalsis, like a lack of movement, which is a wood function. So you need more movement there, which is more like maybe exercise, stretching, again, what you can do, or might depend on what your situation is with your, that's why I'm saying talk to your practitioner, because some people aren't in a position where they can just exercise. They might be so unfit, or not so much unfit, but just maybe too tired to even do that. My FBOSS machine just made a little sound in here. It just put out a receipt. So yeah, thank you so much for thanks for your questions and stuff. And sometimes it's hard for me to answer clearly, because one is I don't want to give people misleading information, and sometimes there could be multiple answers for things. But I think Chinese medicine thinks people can be empowered to learn about their body themselves, and there's some things that you can do, and you're not going to have too much detriment if it was wrong for you. That's what I'm trying to get at. So certainly this person here, Angela, is saying pumpkin and sweet potato helps you go. Yeah, for sure. So that's more like moistening your bowels, and that's good. So you can either get your bowels moving by purging them or increasing peristalsis. That's how laxatives work, right? They get that peristalsis kind of moving. And if you do that very violently, it really hurts, right? It's like, cramping and crazy, and salty kind of flavor does that as well. So salty gets your bowels moving. Like some people just have a bit of salty water, like that can kind of do that. But often the salty flavor in Chinese herbs is used for other things, and that can be like a side effect that can happen where people's bowels are kind of moving too much because of that salty flavor. So you don't want to have a lot of salty in your diet in general, because you don't want to be purging all the time. But your bowels can also be stuck or hard to go because of dryness. I think I made a video on this channel about constipation, so there might be something like that. So moistening the bowels, nuts and seeds, hemp seed oil is the best one. So that's a Chinese herb, whole ma ren, hemp seed. Now, some countries you can't get it, and some you can, depending on the laws. But there's no THC in the hemp seed, right? It's really, you can't get high from the seed. And as long as they're crushed in a way that they can't grow, a lot of countries can sell it. But if they make it into the oil, obviously nothing can grow. You can't grow a hemp seed plant from cannabis seed plant from the oil. So you can buy this oil freely kind of now in most countries. So you just have a teaspoon of the oil once a day, and maybe up that to 2 teaspoons if you still couldn't go. But that could help if you were very if it was dryness. So you might have dry, pebbly kind of stools, or feel that you need a lot of bulking up of your stools. So this kind of pumpkin and sweet potato thing is more like moistening, but also fibrous, right? So because your bowels are a tube, right? And so if this happens to people when they go on a high protein diet, like trying to do keto or something, and they just find that they can't go because there's no bulk, there's no fiber to bulk up. That's what fiber does. It bulks the stool. I don't know if in your country, if you have a thing called Metamucil, but that's a product that's sold over the counter. And yeah, it's fiber. It's just bulking your stools, puffing them up. Right, there's still more questions here. I'll try to answer them for you. I'm just going to have a little sip of my wine. It's midnight now, my time, but we're on a roll now. What would be the reason for prolonged heavy periods in TCM? So prolonged periods, heavy periods means you can't stop the bleeding. So in one sense, it could be your earth element. Like this in TCM, they say the spleen holds the blood in the vessels, right? So when you have bleeding, it's either leaking out, which is the spleen qi issue. So it's like an issue of deficiency. there's not enough energy to hold the blood in the vessel, so it leaks out. If blood pours out or it floods out, it's a bit gross sort of thinking about that, but let's say think about a blood nose. If it floods out, so you see this often with heat when kids run around, right? They run around the hot weather. And next thing you know, they've got this profuse bleeding, blood nose, that kind of stuff. So that's a more of a heat aspect. So heat, it can drive the blood out of the vessels, push the blood out. And that's a very TCM concept, not really classical Chinese medicine concept, but it still makes sense in that way, that there's these two ideas of how blood can kind of come out. So when you have heavy periods, it's often a deficiency, and how we would treat that is often with like very strong nourishing blood herbs, and sweet flavor actually is used often with that. One of the herbs that's commonly used in classical Chinese medicine is erjiao, the donkey hide gelatin, right? So you can use I'm not suggesting that you go and do this yourself, but often practitioners, because you can't just use gelatin one by itself. It's just not probably won't work. You need other herbs in the formula, but I'm just trying to use that as an example to kind of tell you how it works. So in my clinic, we don't use the donkey hide gelatin anymore because there's a lot of cruelty to donkeys that happen in that process. And I don't know why the government just lets that go on. The Chinese government just doesn't stop them. Sure that they don't have to beat the donkeys to get the gelatin out of them, but they do. So anyway, my supplier refuses to sell it, and good on him. So we don't stock it either. And we just use a bovine gelatin, which is still like the same kind of gelatin you would use when you're making jelly kind of thing. So I'm not saying have a ton of jelly, although possibly you could try something like that, like having gelatin. But where else do you get gelatin from, right? Where do you get gelatin from? From bone broth. So if you make bone broth, if you're not a vegetarian, Lulu, if this is you, if this is for you, maybe you're just asking for a friend, that's fine too. You could try the bone broth as a food thing. Now this is a good advice in a way that it's not going to make you worse if it's not right, because it's just a food. So bone broth tonifies blood, and when you make bone broth, it'll be gelatinous, right? Because you're getting that's what's coming out of the marrow of the bones. So you're having a highly blood tonic rich substance. And you don't have to drink the bone broth by itself. Like I have made it before where I'll put like that much of it in the cup and then put a bit of hot water with it. And that's a good blood tonic kind of food to have. Or you could just use that bone broth once you've made it in your soups, in your stews, in your other food that you have throughout the week, that kind of stuff. So I'm probably going to stop there because otherwise there'll be more questions. More questions will come. And I'll never go to bed. But I've enjoyed doing this stream for you guys. Thank you so much, everyone, for your support on the channel. So I really appreciate that. And if you have a question, you're watching this after the stream, then you can always put the question in and I'll answer it on a video. I'm sorry I haven't been around much lately making videos, but this is obviously no worries. Glad that was helpful, Lulu. This is obviously a good time to do it. So I'll probably try to do one another time. It's about 10 p.m. my time. I think we started this. So that's good. Awesome. Thanks, everyone, for your support. And I'll see you again the next stream or the next video. And all the best with your medicine and your foods and acupressure and studying. Lots of people on the stream tonight studying Chinese medicine. That's awesome to see. And, hopefully the stream doesn't get taken down because of those other questions that I hopefully answered in a politically correct manner. All right. Thanks, everyone. See everyone. Bye.